Okay, so folks, we're going to make a start. I'm just going to start by sharing my screen as a first and see that you can see it. So can you see my screen?
Yes,
And now is it full screen? And can you see it full screen?
yes.
Okay, excellent. So what we're doing today is I'm giving you a little bit of an overview of the module with an induction. And then what we're going to talk about in a short session is basically an introduction to the physics of cranial ultrasound, which I believe is probably one of the most important topics that we will cover. The reason being, if you don't understand the physics of cranial ultrasound, then really you will not be able to understand how to optimize your images. And I can't emphasize enough how important it is for you to be able to understand how to optimize images. Uh, in between, I might just have to allow a few of our participants to kind of join. Ground rules. So first of all, uh, I really encourage you to try and be on time. So I will always open the portal 5 minutes before. And if you can join 5 minutes before, especially if you want to kind of watch the live view, then by all means, that's the best time to join. Just a little bit more in terms of ground rules is if you leave the meeting and I'm in the middle of a talk, unless I'm supervising another expert speaker's talk, it's really difficult for me to then let you in because I have to go back into the participants. Obviously, what we will be doing going forwards is nominating one colleague to kind of keep an eye on things so that they can actually let others in. Uh, Nuts and bolts. So, very important from our perspective that you basically are attending the cranial ultrasound module. We've previously run a lung ultrasound module, but an introduction to the Improve Academy. We're a not for profit. We don't run this for a profit. But in essence, what we do is any money or any monies that are received by us are actually reinvested back into providing education for low and middle income countries. So there are colleagues from low and middle income countries who are on scholarships as part of this course, and they are free. So in total, we have 35 participants, 20 paid and 15 who are actually learning as part of scholarships. In addition to that, we invest a lot of this back into the website and into the resources that you'll be able to use so that we can provide you the best training possible. We established in 2012, and we've been running courses since, and we run a variety of courses which are face to face as well as online. Now, the aims and objectives of our module, and I'm going to summarize this in a very short slide, is to say that I want to give you a skill. And that is my goal. My goal here is that you are able to take this skill and be able to successfully perform and learn how to do cranial ultrasound. I think if I'm not able to do this over the next 8 to 12 weeks of giving you mentorship, then really, in my mind, I've failed. And that for me, I would say, is a disaster. So I would encourage you all, A, to participate wholeheartedly. The most important aspect of participation is really being able to put a probe on a baby and be able to scan whilst we're learning simultaneously, because that is the best way to learn. We have a peer review system that I will take you through today, but what we will be doing is going through some didactic training where we will be taking you through weekly sessions. After the first three sessions are done, really there is the opportunity for those of you who can store and anonymize images, and we'll teach you how to do that, as well as how we can review them in a way that does not involve anything patient identifiable for us to be able to peer review images. For those of you where there are institutional restrictions around this, there is the opportunity for you to have peer review in your local institute with a trainer or a colleague who is already skilled and certified in cranial ultrasound competencies. The basic part of the curriculum will basically be teaching you how to get and recognize normal anatomy, and then really moving on from there, how we basically differentiate that from what is abnormal. But there's a curriculum which then takes us through the different pathologies And we have a variety of cases that we'll be able to share with you, not just through the learning platform, but also through WhatsApp in an anonymized way to be able to keep you up to date with what I would say is the latest evidence around management of a variety of different neurological problems. Uh, we supplement that with cranial ultrasound protocols that are there in the literature, but we'll also be sharing protocols that we have developed. So we have our own guidelines, and they're guidelines from a variety of institutes which have lent us this with their consent. And this is all part of an article library which is Mendeley accessible. It means that articles which are copyright we cannot share with you, but articles which are available or with author consent that we have on the article library, uh, they are available to you and you can read them in your own time. They will be available to you via Dropbox. In the end, using all these resources as well as the website, the intention from our perspective is you can learn your way. You can either learn by reading, that's through the didactic material that I'm going to take you through at the moment. Alternatively, you can learn by watching videos, and all of the chapters that we've developed are summarized into 10-minute videos. I think all of you will agree that with COVID, the attention span that we've developed as individuals is really quite short. And I think recognizing that there is a huge amount of effort that's gone into the educational methodology to help us learn from each other, and that there's material that you can read which is referenced. There's further references which you can access if you want wider, more detailed reading of the content. But at the same time, for the busy office going, I would say, clinician who has to perform or has already got the background knowledge, everything is summarized into short videos which you can watch. At the end of this, really what we are doing is we're lending you the ability to be able to test your knowledge and your skill. And that is tested in two ways. The first way is by actually a self-assessment of your scans through peer review, which is done through an objective structured tool that we use. And my expectation in the next 8 weeks is if you can all do 5 scans and we can peer review 5 of your scans, that's a start. But for those of you who want to continue, we then offer 6 months of mentorship where we have ongoing sessions after the 8 week period of teaching is over, where we can go through scans again in those peer reviews to be able to sign off a logbook that you may want to maintain. The second self-assessment method is an assessment of your didactic knowledge. That's through an MCQ. Now, for those of you who attend the course and attend the sessions, we keep an attendance record of all the sessions you've attended. And if you don't do the testing or the peer review, at the end of it, you are provided a certificate, which basically allows you to reproduce your CPD. And in total, there are a total of 17 sessions, which will give you approximately 34 hours of CPD. If you go on to have peer review as well as you complete the online MCQ, and it's very easy. It's really just an amalgamation of questions of your knowledge for the first 6 chapters. Really, what is the normal brain is what you're going to be tested on. But we then provide a very detailed reference with certification of your competencies, which we sign off. And there are 5 tutors in this group who will help you do that. So I'm going to stop for a moment and I'm going to let anybody ask any questions. So by all means, do you have any questions so far? It's very unusual to not have questions, but this is what the schedule roughly looks like. So really, the module basically is a module that can be completed quite easily in 5 weeks. So really, if you spent an hour a week just watching the videos that are there in each of the chapters and you complete the first 6 chapters, then really you will get a very good overview of the basics of cranial ultrasound with the normal and the abnormal brain. In terms of further reading, brain injury, doing Dopplers and cerebellar ultrasound, we will be taking sessions on that, and there are chapters on that. But really, from my perspective, I don't really want you to worry about testing in those areas because really the course is formative. It is less summative, it's more formative. Whilst if you do scans, we can critique and we can help improve your skills. And I'll be honest, I will be improving my own skills in this process because I will be learning from you. But we can help you with image optimization. I think doing Dopplers and cerebellar ultrasound, however, are not mandatory components that I put a lot of stress on. If you're able to learn them within this 6 month period, it's icing on the cake. But at the end of it, what we also do is we provide you with guidelines that you can implement locally. We provide you with protocols that you can implement locally, and in particular, guidance around what we call as accreditation and credentialing, which are very important aspects of learning point of care ultrasound. So I would like to emphasize that it's no longer see one, do one. It's no longer you can pick up a probe and put it on a baby and really start scanning willy-nilly. I think what is really important is that there's a structured approach to how you train when you're learning cranial ultrasound towards achieving certain competencies that I will talk about today, with a view to getting credentials that your institute can then recognize. And the institutional credentialing that we work towards is recognized both by the British Medical Ultrasound Society as well as the Royal College of Radiology in the UK. It is also recognized by the American Academy of Radiology in the States and by the Association of Society of Ultrasound Medicine. It involves a structure that is acceptable to all of them. It is credentialing that means that you keep evidence of your scans and your certification and you build upon it with time. So again, there's something for everyone in the course. Just looking through questions. There's an MCQ at the end of the course. There is an MCQ at the end of the course, Mariam. It's very easy. Trust me to say that if you watched the videos for the first 6 chapters and you watched them well, you'd easily be able to get 80% of the pass mark. I will talk about the prerequisites for accreditation, how many minimal ultrasounds are needed, how many institutional ultrasounds will be needed likely in your institution before they can provide credentialing. And it varies from place to place, but I will talk about that today. Uh, Going further forwards, what is the course format? So we have 17 sections, which basically involve an initial 6 sessions, which are very didactic. But from session 4 onwards, we will always start with peer review. Now, there's a little bit of method to my madness in that at the moment we have Ramzan in the part of the world that I live in. And what I would like is that colleagues who obviously have iftar around the time we're starting can actually attend some of the didactic component. So by actually doing the peer review first, which is what we'll be doing in sessions, and you have a total of 10 peer review sessions out of 16 for those of you who want to kind of finish the course within 2 months. For those of you who obviously want ongoing peer review and want to achieve a higher level of competency, it's 6 months, and I will offer you 6 months of peer review. Peer review of the didactic content also involves the test, but we provide an objective structured form to be able to assess your scans. And the intention is you can build up on scans by doing normal and abnormal scans to basically populate a logbook. There are 3 different logbooks that we provide you depending on how much detail you need. And the reason for that is there are about 35 of you who are attending the course. And from my perspective, you come with a variety of different skills. Some of you have already got very advanced skills and are really, you're going to teach me. I'm going to be really honest. I'm going to learn from you. Some of you may not have touched a probe. And the beauty of the course is we cater to all those individuals. There's no discrimination here. And I would encourage all of you to be very mindful of colleagues who have never picked a probe up. I can tell you for a fact that in our lung ultrasound course, the person who I believe did the best was a person who's never scanned. So I think it's really important from our perspective that if you're learning to scan, from day 4 onwards, after the first 3 sessions are over, the concept that I espouse is what we call is PUP, pick up a probe and start scanning. And I will talk you through how you do that. All the didactic content is recorded and goes up on each chapter within 24 to 48 hours. We sometimes take 48 hours to try and kind of modify videos because they can be quite long and it can take time. In addition to that, what we have is we have workshops which are quite interactive, where we'll be sharing cases with you as we build up for you to be able to make diagnosis and learn with us. This concept is called mental modeling. And when I call it mental modeling, what I mean is that really what we do is we pair you up to be able to kind of look at normal and look at abnormal. And when you look at abnormal, there's then the opportunity for you based on case histories to be able to mentally model and make diagnosis. And there's a huge library of content which you can access to be able to watch and look at cases that we've developed over time. We also have very learned faculty. We've got a very learned audience, but we've got six expert faculty, all of whom, uh, some of whom have trained me, and really, I would say, will be able to give you a lot in terms of what you hope to achieve. Now, I'm going to break away now from this presentation, and what I'm going to do is I'm going to talk to you about your account and access because this is really important. So can I just say, is any of you, I've got 32 of you on at the moment, uh, is any of you at this particular point without an Improve Academy account? Can you just put it in the messages if you've not got an Improve Academy account? You can unmute and say you don't have an account, and I'll name and shame you. Anybody without an account? Unmute yourself. Whoa, looks like everybody has an account. Okay. So really, the Improve Academy basically, when we look at it, and I'm just gonna stop sharing at this particular point. Can you see the screen with the Improve Academy on it?
Yes.
Yes.
Excellent. Okay, so that's Kunal who said yes. I'm just getting a few responses here for people who don't have their account. I will have access from the previous. Yes, forward you will, and I will access your account and I'll take you through it. Everybody does. So it looks like everybody does. So really, when you go onto the Improve Academy website and you have your account, what you'll be able to see from our perspective is really this section over here. Can you see that? Which basically details your name. Now, when you see that, really that is your account. And when you go into your account from Wednesday onwards, what will happen is you will have the opportunity to be able to access this module. And accessing this module basically will mean that when you click on it, and I'm just going to close my account, you will have my courses. When you go into my courses, you have skills-based learning. And in skills-based learning, you have point of care ultrasound. And in your module, you will come up with this login, which basically says point of care ultrasound, neonates cranial ultrasound. So this module will be activated for you. And at the moment, it has got 12 completed chapters. The remaining six chapters have not been completed on purpose because we really want you to concentrate on the first six. Fatima, don't worry. I will teach you how to create an account. But the intention from my perspective, once you've been able to access this on Wednesday, is that you can go into it and really all the course material comes up as chapters. Now, when you look at the course material, it's very much follows the algorithm that I showed you in blue, and that you start with nuts and bolts, roles and indications, training competencies. And really, in the first week, this is really what we're going to be doing. So today, we'll probably end up stopping, if we have time, with the basics, if not training and competencies. And really, from there, for each chapter, when you click on it, so if you click on nuts and bolts, it comes up with material which is arranged in a very simplified manner, easily readable, with everything summarized in a video. And each video is not more than 10 minutes. So the intention from your perspective is you can read what you want to, you can watch the video as you feel able. And at the end of it, all the sessions end with their respective lectures, which you can download by clicking. So if you click the lecture over here, basically it will take you to the lecture that I've done today. Now, most of the lectures are PowerPoints and they have got their own embedded material that which all works. If you ever want to use that to teach, or if you ever want to use that for any presentations, you're most welcome to do that. We're quite happy for you to use any or all of the resources that we give to you so that it can help you, especially if you want to teach. More importantly, from our perspective, when you go into the chapters, all the chapters basically have their figures and references, and the references are basically in brackets. So as you can see here, that any referenced chapters, when clicked on, will take you automatically to that reference. Some of them will have the entire article where they are open and copyright is not an issue, but some of them will not have them. And really, if they're Mendeley approved, then they are part of the library. But for some of them, we can't, because of copyright issues, provide you with the articles in the literature. I would encourage you to use your departmental library, your resources like Athens to be able to take you through and locate some of the articles. Some of the articles I have author permission to be able to share with you. But the intention from our perspective is that you will have access to the library for all the references as well, so that you can have a look at them where they're available. But if not, just clicking on each of the links, which are highlighted in green, will actually provide you the ability to be able to access those articles. At the end of every chapter, what we've got is, again, a very short video. You click on the video and it will open up in your portal. This can be viewed on a computer. It's better viewed on a computer, but you can actually download the Improve Academy app and you can actually watch all these videos using your smartphone as well. At the end of it, like I said, for those of you who would want to go through the PowerPoint again, want an activated view of the PowerPoint, you can watch the video and you can see here that by clicking the PowerPoint, it's actually downloading in the background. Uh, Material that's embedded in them, gifts are all activated. Obviously, if you have any trouble accessing it, so just clicking on this basically brings up the entire PowerPoint for that particular session and allows you to be able to then look and access and read it. So really, it's your baby. You can use it any which way you like to be able to learn. My experience usually is that I would strongly try and focus on the sessions and the learning that takes place that week to try and finish the chapters, which are quite easy to read, and then really focus on PUP, put a probe on. Because really what I'd like you to do is learn and do cranial ultrasound side by side. Okay, so that is your link. Now, just remember that when you start reading a material and you cover the chapter, so once you've read nuts and bolts, you've read everything, you go to the end, you have to click next to go to the next chapter. People often get really confused and they can't do it. But by the end of it, once you've completed all the chapters, the last chapter being completed, you will then be able to access an MCQ, which is not quite up at this particular point of time. There is a practice MCQ that is usually put down 8 weeks into it. So you have a window of 8 weeks after the course is complete to finish the MCQ. After that, our lung ultrasound course starts, and I really then will not be able to. Uh, I would say I would normally close the module for MCQ taking. So you must, from your perspective, within the 6 months of having started the module from today, have access to the MCQ if you really want to have complete accreditation. Any questions about that? You can unmute yourself and ask any questions. No questions? Okay. So I'm just going to share again. Can you see my screen? Can somebody say yes?
Yes.
Excellent. Okay. So
Yes.
that's your account and access. Now, what is the curriculum that we intend to cover at this particular point? So the intention from our perspective is we will be covering three aspects of the curriculum. We'll be covering the normal brain. When we cover the normal brain, we will be teaching you how to do coronal sagittal imaging, along with mastoid and temporal imaging. Uh, to be very honest, the PF can give you slightly better view of the occipital region and the occipital horns, but you get most of that information really pretty much by doing the anterior fontanelle if you really have a wide open fontanelle. The benefit of using the posterior fontanelle is there if you find that you've got a very small anterior fontanelle and you're really struggling to access the posterior part of the brain. In addition to that, we'll also be covering Dopplers. As part of completion of this, the expectation that I would have is that, at least for those of you who want to complete level one, and I'll take you through the levels, is that you complete 5 scans, either peer reviewed by us, signed off in your logbook, or peer reviewed by a colleague of yours who can sign off your logbook locally. Uh, we've got a few questions that I'm just going to take. So, can you share the link for the MPROvE app? If you've got Android, you can just download it by Googling MPROvE. If you're an iPhone user, then I'm afraid you we don't have it licensed at the moment on iPhones. Uh, okay, we've got questions. So people have, if you have questions along the way about any of the content or a particular chapter, that is exactly what the WhatsApp group is for. So I intend to reply back on the WhatsApp group. I look at it a few times a day, but it's inevitable that some of you will have questions about your scanning. In particular, for those of you who want to learn about image optimization and how to do and use your machine to get good quality images, it is very difficult for you to do that in an open forum when we do peer review. So the intention from my perspective is you can WhatsApp me, we can direct message, we can also video call using an app which is called Bottom. And for the group who learned lung ultrasound with me, I was able to actually have a look at their machine and help optimize their images as we went along. So this is all available to you. Again, I am going to invest in you for the next 6 months. My intention is that you get the skill. Once you have been through the peer review, really from our perspective, you would have gained a lot of experiential learning. And that experiential learning really can be stored in your logbook. Now, what does that look like? So I'm just going to stop sharing again very quickly my screen and show you what the logbook looks like. Just admitting a few people. So I'm just going to stop sharing. Okay, so okay, is the logbook visible to everybody? Is somebody saying yes,
Yes.
please?
Yes. Yes.
Okay, excellent. Uh, we really want you to have had your coffee before you come in. We like nice, strong voices. We want that enthusiasm. We want that burning enthusiasm. And it usually comes through once we start. But the other thing that I would like to make you aware about is I love asking questions and picking on people. So, what will happen in due course is that during sessions, I will pick out people, especially after the first 3 sessions are over, to kind of discuss things. So, please do not feel intimidated by that because it's a really good way to learn. Now, the logbook, which is made in Word, basically has your details, your registration as you need it, and it takes you through different levels at which we certify your competencies. Now, if you look at the logbook at this particular point, level one basically means that you've completed the first 5 sessions as per the program that I've sent to you. Now, those sessions will include basic ultrasound physics, advanced ultrasound physics, the normal brain and scanning, which includes coronal, sagittal, mastoid, temporal, and posterior fontanelle views, and then really putting it all together so that you can actually identify normal anatomy. The intention of this course is that you should be able to identify normal anatomy through all of these views. After that, really, I would say in the second month, we go to the abnormal brain. And really, when we start doing the abnormal brain, the intention is that we will start with peer review showing you cases based on topics which will cover IVH, periventricular leukomalacia, HIE, hydrocephalus, congenital hydrocephalus. So, a lot of those things alongside management, what is the benefit of neonatal cranial ultrasound in those particular pathologies, and how does that compare with MRI? So, there's a lot of kind of education around that. But for a peer review purpose, the intention from our perspective is that you, after level one, say maybe in your first month, have completed 5 introductory scans, and these are normal scans. And as long as you've got coronal and sagittal views that you can do and identify anatomy, that's good enough for me for you to clear level one. Once you enter level two, and level two to level four is a continuum. And the reason I say it's a continuum is because we all learn at different paces. So I'm just going to give you an example in a kind of myself. I was the dunce in my class. So really, I was the backbencher. I used to sit right at the back, and it took me an awful long time to learn. Mathematics was my absolute bane. So I used to hate maths, and I somehow I scraped through. But really, at the end of the day, I did scrape through. Uh, my intention actually at this particular point is to highlight that we all learn in different ways and at different levels and at different rates. Some of us have got the skill and have got the knowledge and will progress more quickly than others. I would encourage those of you who don't have the background skill or who are not scanning not to be intimidated. Because trust me, if it takes you 6 months even to be able to do this, I will support you in that process. And what is very important is that really for most people, 12 weeks of scanning and being able to do about 25 cranial ultrasound scans, having a mix of normal and some of abnormal, gives you very good skills in being able to then perform scans, I'd say under indirect supervision. So when you look at these levels, as you can see in your logbook, really what they talk about is performing a proportion of the initial scans under a degree of supervision, some of which we will be able to support. If you have a mentor locally, they can support you. If you do not have a mentor locally, we will support you. How do we do that? We teach you to anonymize your scans so that there's nothing patient identifiable of them. Your institution has to obviously be comfortable with that, but you have a Dropbox account that you share where you can store those images in an anonymized way within your logbook so that they can be reviewed by us for peer review. We then provide individual feedback. Now, the individual feedback can be directly via WhatsApp, or if you feel that you want one-on-one sessions. And we had a lot of colleagues who did lung ultrasound with us who felt more comfortable having one-on-one sessions to be able to discuss their scans because it was very difficult for them to get institutional permission to be able to share anonymized scans. Again, we're very happy to do that. Those are not sessions that are recorded. Those are not peer review sessions where we record images or scans. Really, what we do is we peer review your scans and we give you feedback. And often, what I'd say is the opportunity to then have a look at your machine and help you optimize on your machine is also something that can be done. But for most of you, the expectation is that over 12 months, you're expected to complete between 50 to 100 cranial ultrasound scans. The majority of, I would say, literature talks about a minimum number of scans to be able to become competent and proficient in being able to interpret normal and abnormal. And at the moment, there is no firm evidence about what this number should be. But a good example is the ASIM criteria is doing 25 scans, 50% of which should be abnormal. If you look at the Royal College of Radiology criteria, they want their trainees to do about 200 scans. Now, 200 scans is from my perspective just unachievable. Not only is it unachievable, I don't think it's fair to babies. We can't just scan babies to practice on them so that we can get our competencies. So I think somewhere in between really is what you have to achieve and aim for. And experience says that it's not the number that is important for us, it's more your learning curve. And I know people who have done 10 lung ultrasound scans, and really their machines and their ability to scan was even better than mine. And I've done hundreds. So trust me to say that that learning curve can be quite short for some people. And for some people, it may take longer. And with all due respect, again, my emphasis to you is do not feel worried about that. That is important because really what it's doing is giving you the ability to be able to scan, learn at your pace. And that is important. Everybody learns at a different pace. I was lucky I got through maths in high school. Now, level five, I would say that institutional credentialing, and I'll give you an example. We have institutional credentialing where I work in the Corniche, where there's an expectation that people have credentialing after having performed a certain number of scans. Your own institutional guidelines might specify a number of scans or certain pathologies that you have to do in order to achieve them. Again, we're very happy to support you sign off that. Uh, if you have a local mentor, then I would strongly encourage that you get help from them because again, their ability to be able to teach you on the machine and teach you image optimization really, really helps. But the intention is by going through this process, really of completing scans, I'd say 50% of which should be abnormal after the first 8 weeks, you get a good ability to be able to perform cranial ultrasound. And experience says that if you're scanning regularly for about 12 months, uh, there's no doubt in my mind that you will all move towards level five. Level five is basically maintaining the skill. And on average, I would say that for cranial ultrasound, you probably need to do at least 50 scans in a year, not just because you're maintaining your skill, but because the variety of pathology that you will see. And a simple example that I'll give you is I've only ever seen and diagnosed 2 cases of holoprosencephaly on a cranial ultrasound, and that's because it's quite rare and the incidence is quite low. So, again, quite important from our perspective that you continue to scan after that because the risk if you don't is that you will miss rare pathology. You will be good at scanning, but I have seen holoprosencephaly missed. I have seen very subtle calcification missed, uh, mild to moderate HIE again. In babies can sometimes be quite difficult to diagnose and needs a lot of clinical correlation. This is the core curriculum. Now, it looks very detailed, and I don't expect that you will be able to achieve all of this even within, I would say, the 12-month period that you're scanning. But actually, what I'd say is as you continue, and I keep my logbook to date. So I have a logbook for my lung ultrasounds. I have a logbook for my echocardiography. And whilst I don't and no longer keep a logbook for my cranial ultrasounds, I have kept the first 200 cranial ultrasounds that I've done in a log, which is a decent variety. So, I would encourage you to do this. I also understand that time is a limitation. And if time is a limitation, then, I completely acknowledge that some of you may not want to maintain a logbook, but may just want to improve your skills and image optimize because you've already got the skill and we're completely comfortable supporting you with that as well. So this is not mandatory. This is not something that everybody has to do. What I would say is that if you want accreditation certification through the course, then yes, you will have to keep a logbook. Any questions? I've been
Like,
talking for a while
yeah,
now, so I need
yeah.
somebody to
Uh,
start asking me some
I,
questions.
I would like to ask something.
Yeah,
So you were explaining right now that when we are maintaining this logbook, at least 50% of the scans should be abnormal. So how do we make sure that
that's
once
a
we
that's a that's an
start doing
absolutely
this?
fantastic question, and that's why I would say that uh, the expectation is that you have 50% of your scans are abnormal. But we know that, if you have and you work in a level one or a level two center, you're not going to have a lot of extremely preterm babies to be able to scan, to be able to have a lot of IVH or post hemorrhagic hydrocephalus. For us, when we talk about accreditation and keeping the logbook, uh, really what I'd say is your ability to scan and achieve and basically get marked by what we call as an ACCS tool is more important. So if you're not able to do that, but you still have good scanning ability based on the assessment of not just one, but there are five tutors, then really from our perspective, we'll have no hesitation in providing you accreditation, but with the caveat that you probably need a little bit more practice to be able to, say, diagnose or look at more cases of IVH. And as you achieve that, and if you go on to achieve that later on, we upgrade your level of certification accordingly. Does that make sense?
Yeah, it does. It does. Thank you.
Any other questions? No questions? No questions? Should we save all 100 scans in our logbook? No, no, no. There's no expectation to save 100 scans in your logbook. So the intention from our perspective, Anastasia, is that as we did with lung ultrasound, you'll have a Dropbox. And like I said, over 6 months, I think with your levels of skill, if we could review 25 of your cranial ultrasounds and you had pathology in about 50% of them, then really again accreditation would not be an issue, and that's because I already know that you do ultrasound. So there's fluidity to it, there's common sense to this approach. So no, we don't want you to do 100 scans. I don't have enough space in the Dropbox to be able to save that. But what I do want to be able to do is help improve your skill if I can. It may be better than mine. The peer review will be one-on-one review or a team can attend the review, Mariam? Okay, that's an excellent question. Now, can I just say that in the Corniche, unfortunately, we will not be able to share images. It's not confidential. Rules say that you can't do the peer review online in a group. So for everybody in the Corniche who's attending this, I will do one-on-one peer review for you in the institution where you do the scan and I basically will report the scan, but will do it with you so that you're doing the reporting side by side. You can still maintain the logbook and get the sign off done. And I think from our perspective, we just have to do 20 scans for you to be able to get credentialing. So once you've done those 20 scans with me, I'm very happy, for the sign off to take place. And it doesn't just have to be me. It can be any of the other consultants. We'll all, be supportive of that. Any other questions? Nobody want to unmute themselves?
Any particular machine specifically which we should be using for doing these scans, or whatever
No,
we have in our
no.
institute,
The
that's fine.
intention from our perspective is we will teach you to use every machine and every probe. And as I will explain to you, I mean, ideally, you should have a curvilinear probe. But really, if you don't have a curvilinear probe and you have to use something else, then, you may have to use the sector probe. Definitely, if you want to look at the meninges and you want to look at kind of extraaxial space, with, I would say, a good deal of accuracy and definition, then using a linear probe with a good footprint is just as good. What I would definitely say is that using a hockey stick with a frequency of 16 in a term baby will not give you good images. So
We
the
we do have a curvilinear probe.
sorry,
We have a curvilinear probe with
yeah.
us, so that
Experience
should be
says
good.
most of you will have curvilinear probes, and that's what we'd want to teach you on. There are certain situations where using a high frequency linear probe is useful. So I would strongly recommend, that we learn with the curvilinear probe, but I will be showing you images of other probes as well. And in particular, for like when you have to go for the mastoid fontanelle or the temporal fontanelle, sometimes the fontanelle is so small that a curvilinear probe won't work. And actually using a small sector probe might give you a much better definition. I think the key question is why you're doing that scan. Why are you doing the mastoid view? Are you measuring the cerebellum? Are you looking for hemorrhage? So again, we'll talk about which probes might help when you have very small fontanelles. Any other questions? Okay. So what I would like to do now, having done a little bit of the induction, is emphasize you need to have registered yourself on the Improve Academy. You need to have an account. If you have an old account, then from my perspective, I will be adding your module for your learning on Wednesday. So on Wednesday, if you all check at exactly 6 p.m., that is an hour before we have our session, then from our perspective, you will have access to your own module. This is your personal module. You can keep notes on it, you can write on it, you can store articles. You will also have access to uh, the article library, which basically has 16 chapters on it, which has a variety of different articles. All of this will be active by Wednesday. If you're not registered on the Improve Academy account, I can't do anything about it. It delays things. So I strongly encourage that you do that. In terms of being able to access the material, if you notice any issues with your ability to access things, then come back to me. Some people can sometimes have difficulties with moving through the modules in particular. Now, I also need to know from you whether you want peer review and you're able to do peer review in a group, or whether you would like one-on-one peer review. Uh, I would also need to know from you how many of you would like Dropbox access for your logbook to be able to store images in them. So don't all reply back in the common group. Just reply back to me by PM, private messaging me on WhatsApp. And then really what I will do is on Wednesday, I will be sharing a Dropbox account. Now, what does this look like? So I'm just going to share my screen with you again. So all of you can kind of see a Dropbox over here. Now, in terms of Dropbox, your actual account will basically have a name on it, and you will be using MySpace. So you will have to register with Dropbox, but I do not want you to use your space. Your space is limited to 2 GB. So if you really want, and what I would normally do is I will create Dropbox folders for all of you with your name on it, and it will come under basically a cranial ultrasound master program. So it will have a session which basically talks about uh, teaching files and videos. And in the teaching files and videos, each of you will have your own individual account by your name with your logbook in it. That is a Word document. I will show you in the next few slides how you can use the Word document to be able to embed your videos and how it's best done. But really, from my perspective, the important thing is that you express an interest. This is completely, I would say, encrypted. So it is encrypted to the point where I've got it encrypted by a software called Kaspersky that cannot be hacked. But what is very important is that when you keep your files in it, you do not store them on your laptop, or if you store them on your Dropbox account, you also store them on my account as well, because after 2 GB, which will run out very quickly, your Dropbox will become full. And once you synchronize your Dropbox, uh, this is this is the article library that you have, which has got 17 chapters. The content on this will probably take up three-quarters of your Dropbox. So you'll run out of space very, very quickly. Once you have your logbook, and I'm just going to open the logbook again. So this is a PDF version of it, but you have a Word document that'll be saved. But the intention from my perspective is you can either have these things signed off by a local trainer. Alternatively, once you've done the chapters on Nobology, on the layout of the machine, the portal automatically records the time spent and the fact that you've accessed them. And once you've accessed them, I will then date and sign to say that you have completed the didactic training with regards to that. Your peer reviews will give me a good understanding, really, of how well you use the machine and image optimize, and how well you're using your probes in terms of probe optimization. But really, once you then display elements of the coronal views and the sagittal views, once you've done your first scan, I've observed it. Once you've done your second scan, really, you've done it without my help, so that's supervised. Once you've done 5 scans, then really you're competent to actually perform this under supervision. In terms of independently performing ultrasound scans, my expectation of sign off here really depends on the quality of your imaging and the quality of your scanning. And it may be that some of you uh, have got more experience than I have in doing cranial ultrasound, and I'm feeding you eggs. So, that sign off would really be based on your previous experience, your credibility, and the demonstration of those 5 scans. On the other hand, if you've never picked a probe up, then I think we must acknowledge that it will take a slightly longer time for you to achieve that. But this is formative assessment, and we use an ACCS tool to do it. So the expectation is that once you've demonstrated those views, at some point in the next 6 months, most of you will have definitely achieved the ability to do things under indirect supervision. At least in the Corniche, for those of you who I'm supervising, once you've done 20 scans, then technically you meet our criteria for being able to do independent scans. And personally, for me, for most of you, I think once you've done those 20 scans, and if they're of good quality, I would have absolutely no hesitation in signing you off independently. I am giving you 6 months. That's 6 months of my life so that I can encourage you to be able to get this skill right and to do good, high quality scans. I will invest in you. And when I say invest in you, what I'm saying is that there are 16 sessions with 10 peer reviews. But for those of you who need one on one peer review, we will look at times in between so that we can support you to achieve those skills. If you've got colleagues in your hospital, use them. Please take their help. They will be able to help you use your machines much better than I will be able to over the phone, over bottom. So I would strongly encourage you to use them. Again, you're not going to be able to do all of this and gain all these competencies in one go. For those of you who work in level 1 centers, being able to kind of diagnose congenital hydrocephalus or post-hemorrhagic ventricular dilatation may not be possible. But really, that doesn't mean you can't learn how to measure VIs, because VIs can actually be done in normal babies. And as long as you demonstrate in one particular session that you can measure VIs, then we can really tick off those things. Third ventricular measurements can be ticked off. And when and you do ever see a congenital hydrocephalus, keep it in your logbook. Uh, Come back to me if you can. And like I said, this is open ended. We'll sign off what we can uh, when we can, but we need to see the evidence for it. In terms of storing your images, it's quite easy to do. So, what we normally recommend is that you create a PowerPoint. So, a simple example that I'll give you is, and can you all see my screen? Can you see the PowerPoint?
Yes,
Yes.
yes.
So, the intention from our perspective is that once you've done a case, and this could be a normal case, all we need is the case. We want a history, a small history in literally, I would say, 25 words, which basically gives us a kind of an SBAR kind of an overview of what's the indication for the scan. And then, really, what we'd like you to do is put in your images. I would say that really you're talking about 6 corneal and 6 sagittal images, and that's all we need to see in the first month. We do not need to see more than that. So you put, and normally what I'd say is you can put all your sagittal images and corneal images in 3 to 4 slides so that we can review them, so that we can talk. You can talk to us about the structure on them. Obviously, for those of you who are able to anonymize and share, we do this in an open forum because others learn from you. And the beauty of this learning is you see scans from different machines. You see scans from machines that are very good. You see scans from machines where it's difficult because I have worked in a large number of countries where getting a good quality scanner is very difficult. That does not mean it will not give you good information if you clinically correlate. If you mentally model and clinically correlate, you will be able to make very good diagnosis. With time, with skill, you will be able to image optimize and you will be able to do very good scanning, even with a machine that may not have a curvilinear probe. So trust me to say that really What we want you to do is be able to share this. But once you've shared the images and they're embedded, that's your case, and that's case number one. And really, what you are doing then is you are using Word to insert that PowerPoint using the insert function into this area. Just putting a gestation weight, why you did the scan, any significant findings, and writing a reflection if you need to. If it's a normal scan with nothing on that, where you organized yourself well, then really you've stored the image here. And this is basically for your supervisor sign off. But really, for those of you who need institutional credentialing, this is the best way to do it. With the Word version, you're most welcome to take off the improved logo. You're most welcome to use your hospital logo if they're okay with it. You can take and use no logo, but experience says that by the end of it, you have evidence of a sign off of your competencies along with the stored scans. Now you can move from any hospital anywhere in the world, and this is what I've done. I basically got my lung ultrasound competencies uh, verified in the UAE by actually maintaining this. But as you move along, you scan protocols, you achieve different levels. And at the end of the day, we give you a very detailed reference with regards to your scanning ability. It's a critique. It's not meant in any way to highlight areas that, there's no humiliation about this, but we may sometimes want a little bit more from you in terms of, I would say, pathology if you haven't had it, to kind of just emphasize that you try and get those skills. And a good way of doing that, especially for my nurse practitioner colleagues who are working in the UK, if you're working in level three centers, it's not an issue. Again, if you're working in India, I don't think it'll be an issue at all. But I think if you're working in a level one center, that can be very difficult. But again, for those of you who are working in the UK, trust me, making a diagnosis of neonatal meningitis on a cranial ultrasound might take a lifetime. Uh, Looking at cerebral abscesses, those kind of appearances, these are things that are very commonly seen in India, but not so commonly seen in the UK. And that is the beauty of the course. We have colleagues from all over the world, people from India as well, and including trainers from India who will be able to cover these topics and actually show you what that pathology looks like. Uh, that's really it, actually, for induction. Uh, I'm not going to do physics today. I'm going to do physics on Wednesday. I think it's a good opportunity for us to wipe a clean slate because what I'd like to do is just give you the opportunity to ask me any questions.